So good morning, everyone. Thank you for the introduction, and thanks for inviting me to present our findings on drug checking intervention among young gay, bisexual, and queer men in Vancouver. So I would like to respectfully acknowledge that this presentation and this work takes place on the unceded indigenous territories, including the territories of the Squamish, Tsleil-Waututh, and Musqueam First Nations. So drug checking is a public health intervention to identify the contents of illicit drugs and provide people who use drugs with information to make informed decisions about their drug use. Drug checking can be conducted using a range of technologies such as the colorimetric reagent test strips, or spectroscopy to identify the presence of one or different group of substances. In Vancouver, drug checking services have been implemented in the downtown east side area since 2016 to inform users of the presence of fentanyl in their drugs to address high rates of overdose death. However, the downtown east side area is a concentrated urban drug scene with a large population of people who inject drugs, which could be highly stigmatizing and thus limiting the access to drug checking services for those who are not situated in this specific area. At the same time, there is a political will on the BC health authorities to expand drug checking services to other neighborhoods in Vancouver, as the overdose deaths comes also outside downtown east side. Based on the mobilization of community-based organizations and due to gay, bisexual, and other men who have sex with men, GBMSM is a population who experience high rates of substance use. A pilot community-based drug checking intervention was recently established in Vancouver. Thanks to the collaboration of 4 different organizations, this drug checking intervention was implemented between July 2018 and March 2019. This intervention offers free access to a package of drug checking services, including spectrometer and fentanyl strips, harm reduction, and safer sex materials. This pilot consisted of 3 different stages, including pop-up events and multi-week ongoing drug checking services situated in a community-based healthcare clinic that serve GBMSM. To provide you a better understanding of the perspective of young GBMSM about the drug checking services, we conducted 2 separate analyses from 2 different datasets. First, we examined the willingness and acceptability of using drug checking services among GBMSM through a set of 50 interviews conducted last year before and during the pilot drug checking intervention. Second, we examined experiences of stakeholders who were involved in the drug checking pilot study for GBMSM. We conducted 7 interviews among a diverse sample of stakeholders, including community members, managers, and technicians, just after the pilot intervention. Among young GBMSM, most of them hadn't heard about drug checking services and therefore have limited knowledge about these services. For example, Panda told us, "Some people have fentanyl test kits. I don't know how accurate those are, but I have seen my friends use them, because I'm pretty sure it's a lot more contaminated now. But they were testing coke. I didn't try it because I don't do coke, but I have no idea when they got it." As mentioned by Panda, the majority of our participants reported that knowledge comes from their friends who have previously used drug checking intervention, like, for example, in musical festival. Participants also expressed a high interest in drug checking services, especially to be safe and reduce stress related to substance use. For example, Connor said, "I think it would be definitely a good thing. I think it could make me more easy about using drugs. You know, if I can go in and take it and get it checked, and now I know for sure 100% that it's safe. I think it could relieve some of that stress around taking drugs. During the interviews, participants reported their fear of getting arrested when they will attend drug-checking services. Salvatore told us, I think they're kind of risky in the sense you don't know what's going to happen after you get your drugs checked. They're either going to get taken away or you are going to get arrested for acknowledging that you have the drugs. Right? Ultimately, I think if you get your foot in the door, that's not always a guarantee. To continue with participants' concern, the question of accessibility was one of the main concerns. For example, Anthony said, I think that's pretty neat. I would use it myself if it was more widely available, like if you didn't have to just go across town to one place to access it. Drug-checking services should also deliver with a confidential and non-judgmental approach as requested by Samuel. Samuel told us, if they do it at Pride, I would recommend they have a closed booth, because I don't think many people would go there. If it was inside a store, at least, that would be better, because I think people would not use it for the fact of being judged by their peers or people around them. About the stakeholders' perspectives, several factors were mentioned to facilitate the access to drug-checking services for GBMSM. The first facilitator is the opioid crisis context that helps to implement the drug-checking services as an overdose prevention site. David told us it was really easy. I think the police in Vancouver is very aware of the crisis and really willing to work with all the organizations. We have the guarantee that the police are not going to go and just harass people there, because it's considered like the overdose prevention site, where people can use their drug, a space where there's harm reduction. Based on their previous experiences, stakeholders also recommend to integrate GBMSM as peers for improving the link between the community and drug-checking services. For example, Krista said, one thing that I wouldn't have mind touching on a little bit more was the importance that we have found with using peers in the drug-checking service. And we found that's been extremely helpful in bringing people to a service because they know the community and they are friends and they are very well connected in that site. Promoting and advertising on drug-checking services into the GBMSM community was also discussed by stakeholders as a strategy for connecting GBMSM to these services. For example, Drew said, I guess a piece would be around publicity, of course. You know, there was a marked increase between the first and the second event, and I really do think that a lot of people that heard about it, like news online or through a friend who saw the news or something like that. So finally, our findings show that first, drug-checking intervention can enhance knowledge of GBMSM on substance use and risk reduction, harm reduction strategies. The promotion of safer drug-checking spaces are needed to reduce stress and fears related to substance use among GBMSM. Developing consistent and confidential drug-checking services through a network of peers could be an appropriate strategy to facilitate the access of GBMSM to these services. I would like to thank the study participants and also the team who supported this research, especially Peter Young and Rod Knight. And I would like also to thank the funding agency, the Canadian Institute of Health Research. Thank you for your attention.